Now, maternal fetal medicine specialists say miscarriages happen in nearly 20% of all known pregnancies.
And medically speaking, if a woman needs medical assistance to pass the non-viable fetus, it is considered an abortion. With the overturning of Roe versus Wade, what impact is this going to have on how doctors treat women who miscarry? Well, News 19's Madison Neal joins us in the studio to explain.
Jerry, doctors tell me that this is going to be tricky and it's still unclear to them. Alabama has officially banned abortions in almost every case, and OBGYNs tell me that they're still getting guidance from legal teams on how to interpret the law when it comes to miscarriages. Health professionals in Alabama are still trying to sort out what the overturning of Roe versus Wade means for miscarriage care.
It really puts the physicians in such a difficult situation, when you have to do the right thing for your patient, and then you're restricted by sort of legislation.
A miscarriage is also called a spontaneous abortion in medical terminology.
We're talking about a pregnancy that does not appear to be viable. We know that it's in the uterus, and it's only up to about 20 weeks in pregnancy.
Huntsville OBGYN Dr. Sanithia Williams says management options include giving the female time to naturally pass the non-viable fetus, giving medication assistance, or surgical management to empty the uterus.
While spontaneous abortion is, as it is in the name, spontaneous, the management of spontaneous and induced abortions are the same.
The course of action depends on gestational age, the woman's current health, provider training, and hospital policy.
If someone is sick, especially bleeding excessively, having a severe infection, the treatment for that is to evacuate the uterus or remove the pregnancy.
Alabama law now states abortions are illegal unless deemed absolutely necessary in order to prevent a serious health risk to the woman.
If it's life-threatening, and you have to empty the uterus to save a woman's life, I think that's where you would enact that exception.
If a woman shows signs of infection or starts to bleed, doctors say medical intervention is necessary. That treatment is classified as a spontaneous abortion, which is where the legal waters are currently murky for Alabama doctors.
At what point, when is saving a life imminent? When do you call it, right? How close you have to be? Somebody's bleeding heavily, but they're not hemodynamically unstable yet. Do you have to wait?
And Dr. Williams says because miscarriages are so common, she encourages women to be familiar with their options and to talk with their health care providers ahead of a medical emergency, even in wanted pregnancies.